everyone to please take your seats. We are ready to begin this important journey together in another a minute. May I request everyone to please take your seats. We are ready to begin this important journey together. Once again, good morning. A very warm welcome to Maven Connect 2025, an initiative that brings together the brightest minds, redefining the health benefits. Joseph, it's my privilege to be your host for this energizing day of knowledge sharing and collaboration. To officially open today's summit and set the stage for the conversations ahead, it is my honor to invite a leader whose vision, passion, and unwavering commitment continue to inspire excellence in our industry. Please join me in welcoming Mr. Nikhil Chopra, Chief Business Officer, MediAssist, for the opening address. Nikhil, may I have you on the stage, please?
Good morning, everyone, and thank you for joining us today. It's an honor to be here representing MediAssist, an organization that has spent decades at the intersection of technology, healthcare, and trust. Last year, at the Maven Connect and Raksha Summit, the Borderless Health Report set an ambitious goal of a health system without barriers to access, affordability, or trust, aligning with the government's vision of insurance for all by 2047. Our theme today, Sustainable Benefits and Effortless Experience, captures the dual purpose that drives everything we do. We believe that the future of healthcare lies not just in expanding access, but in ensuring that every stakeholder, the member, the insurer, the broker, and the healthcare provider, experiences predictability, consistency, transparency, and value. Healthcare has traditionally been complex, fragmented, and often stressful, especially when people need it the most. MediAssist exists to simplify that experience, to turn healthcare access into something effortless, intelligent, and humane. Our vision of borderless health is about breaking barriers, not just across geographies, but across systems, processes, and perceptions. We're talking about tearing down silos in healthcare. When we talk about means healthcare should be available when and where it's needed. Affordability means managing medical inflation, design, not compromise. And and trust means that every transaction, every claim, every interaction is grounded in data integrity and transparency. These three principles, in our opinion, are what make 100% cashless in healthcare achievable. When systems speak to each other and data flows seamlessly between all stakeholders, healthcare truly becomes borderless. We are here because despite progress in digital health, the ecosystem still operates in silos. Insurers struggle with information asymmetry, brokers often lack real-time visibility, providers are burdened with administrative complexity, and members, the people who we ultimately serve, are left navigating an opaque system. At MediAssist, our purpose is to connect these dots, to create a unified ecosystem where every stakeholder benefits from shared intelligence and frictionless workflows. We've reimagined this experience through three connected enablers: a health data backbone of trust that links every stakeholder on one platform, an automation engine of efficiency and integrity that eliminates manual dependencies, and mobile access for universal cash confidence, empowering members, other stakeholders alike to act instantly wherever they are. These three elements combine to create a connected, responsive ecosystem, one that benefits everyone from insurer to provider, and most importantly, the member. Even as we move toward digital healthcare, let's acknowledge the reality on the ground. And technology meets trust. Our progress is measurable. Last year, we processed over 90 million claims as MediAssist. 70% of these claims by value were cashless, much higher than the industry standard. 85% of the cashless claims were submitted by providers digitally. 15% of all cashless discharges, accumulating to over 400,000 people, left the hospital before the bill was even generated. All of this coming from 4,000 hospitals in the network who have partnered with us to enable this experience. Through our proprietary fraud, waste, and abuse detection algorithms, we've already saved more than 400 crores, preventing financial leakage and protecting both insurers and members, leading to containing medical inflation to 4% against the industry average of 15%, proving that affordability and access can coexist. This is just the beginning. Our ambition is to take this proven model global, combining our technology platform with local expertise to redefine managed care and cost efficiency across the region, leading to 100% of the industry programs being profitable and 100% of all claim journeys being effortless. Today, India sits at just a single-digit health insurance penetration. To reach insurance for all by 2047, we need to move to double-digit penetration at 10x leap. Given that affordability and access are so central to borderless health, it's only logical that as an industry, we must fix the cashless experience, because that provides the best demonstration of the power of health insurance. Today, 15% of the claimants experience the ability of leaving the hospital before the bills are generated. We want to ensure that 60% of the insurance industry's cashless transactions, 20,000 plus providers, are effortless and pleasant. Our ambition is to make effortless cashless the new standard, not a luxury reserved for a few, but a consistent experience for all. We are redesigning workflows so that every claim, every discharge, every settlement happens with minimal effort. To do this, we are building technology that anticipates needs. For brokers, that means real-time dashboards of utilization. For insurers, it means predictive claim patterns. For providers, it means instant pre-authorizations. And for members, a simple assurance, you're covered. The cashless experience must be invisible, frictionless, and universal, where technology works silently in the background to deliver care without delay. As I close, I want to return to where we began: sustainable benefits and effortless experience. Sustainability and effortlessness are not competing goals. They are complementary outcomes of intelligent design and partnership. When technology enables transparency, every stakeholder wins. Members experience convenience, brokers and insurers gain predictability, and providers achieve operational stability. Our commitment is to build a future where healthcare access is defined not by privilege, but by design. Intelligent, inclusive, and deeply human. At MediAssist, we are proud to stand at the forefront of this transformation, connecting insurers, brokers, providers, and members into one ecosystem of trust. Thank you all for being part of this shared journey, because the real power of healthcare lies not only in the systems we build, but in the confidence and care we create together towards a world of sustainable benefits and effortless experiences for all. Thank you once again for your patient listening, and I look forward to interacting further with you all through the day.
Thank you, Nikhil. I would like to call Nikhil again on the stage to present for Simon Godfrey for the keynotes.
Hello again. I have the honor and privilege of introducing and calling upon stage somebody who I've met a couple of times prior to this, but I've always had a fantastic time conversing with him. And we are very, very lucky to have him with us. So, this is Simon Godfrey, Head of Health Solutions for Asia Pacific at Aon. Simon brings with him over years of experience across the global insurance and financial services industry. In his role at Aon, he leads the firm's health solution business across the Asia Pacific region, working closely with insurers, brokers, employers and healthcare providers to shape innovative and sustainable health benefit strategies. Over the years, Simon has held senior leadership roles across the UK, Europe, and Australia, and has been instrumental in advancing global thinking around people risk, well-being, and healthcare cost management. We're truly excited to have Simon join us as our keynote speaker today, because his global perspective on health systems, benefits innovation, and cost sustainability resonates strongly with the challenges and opportunities we are navigating here in India. His experience in transforming employer and insurer-led healthcare across diverse markets provide us with valuable insights as we continue to build a more connected, data-driven, and resilient health insurance ecosystem in our country. Please join me in warmly welcoming one of the foremost voices in our industry, Mr. Simon Godfrey.
Thanks, Nick, and good morning, everybody. It's a great honour and a privilege to be here today. It's not every day that you get an Australian who lives in Singapore to turn up in India and talk to them about their own healthcare system, but I'll try to do that some justice today, because I think the future is really bold as it relates to India. Forgive me, I will repeat some of the things that Nick has said this morning, because I think they are a big part of what's going to happen in the future of healthcare in India. And as we go through the first session today, I am going to look at access to healthcare in a seamless, affordable way that's built on trust. Technology, data, and empathy are all key to this. And without these things, we can't achieve the goals that Nick talked about earlier. And if all countries around the region were to focus on those goals, then I think the world of healthcare would be a lot more joined up, a lot more seamless, and a lot more successful for the people who need the healthcare that we're talking about. I'll talk about a number of themes, but inclusion, innovation, and collaboration, I believe, can help India deliver healthcare that's simpler, smarter, and truly accessible to all. And I'll go through these themes throughout the session this morning, but before I do that, I just want to touch on what's going on outside of India. That does actually impact what happens inside of India as well. This is a view of the trends that we're seeing across the region. Cost of benefit provision has pretty much been out of control since the pandemic. A lot of work's being done to control cost, change benefit plan designs, improve systems, and all of those things are starting to now click into play, and I'll touch on that as I talk about the medical trend across the region and across the world. AI adoption, hugely important, providing it's used correctly. Problematic if it's not. And I've personally witnessed some of this stuff in the last month, where I was on stage in Singapore closing a conference, and next to me on stage was actually a robot. So shoulders. And as I was closing the session, I could see the robot moving, but I'd asked to have the voice turned down. But it was only when I got to the piece about humans being important, even though technology is super important, as soon as I mentioned the human piece, the robot started to react very badly. And that reminds me of a lot of Hollywood movies that have been made, but somewhere on that stage that day, I had a fear that the robots... I don't think that's going to happen. So as I said, as long as we use these things in the right way, we will get the right outcomes. Prevention's a huge topic. I was on a session earlier in the week with Bupa Global out of the UK, and it was the overarching theme of the entire session. And again, I'll touch on that later. Innovation's another huge one. In the last 6 years, we've seen an antivirus or a vaccine for COVID created in double quick time. We've now got these GLP-1 drugs, which, they're there for a very specific reason, right? Which is to treat certain illnesses. but they're making their way into the mainstream because people want to look better as well. Now, I don't, as you can tell, but maybe I should be using those drugs, but I'm not entirely sure they're fully tested yet. So, beyond that, there's connectivity and collaboration, and I think you'll see the theme coming out that the market needs to get together in a better way to solve the problems we're seeing. And then there's personalization. The more we deal with our clients, the more we deal with the employees of our clients, we're starting to see that the generational shift is driving what people want, when they want it, how they want it provided. And again, that touches back on all things related to technology and delivery. So just to give you a quick shot of what's going on, and I sincerely apologize to the people at the back of the room, this is not huge in terms of being able to see it, but on the left-hand side is the insurance buying cycle. So a quick lesson in insurance here. You can see at the top the pandemic coming in 2020. And then the market went through a very interesting phase. No claims, countries shut down. That meant insurance companies were not paying out, so they were making money. They made a decision to give some of that money back to the clients. Probably not a wise move generally, because if you're making some money, you should keep it for what happens in the future. We then saw the world start to open up a bit. We saw a race from the insurance market to grab market share. We saw the providers within the market look to regain money that they'd lost through the lockdowns and things like that, and the cycle started to move to becoming unaffordable. With the advancements in medical technology and drugs, that all found its way into the system. So we reached a point where cost was increasing exponentially. We're now in a market which I think for the last 2 years in an insurance environment would be described as a hard market. I've never experienced that before in the health and life markets. It's always been stable or soft. We see it every 3-4 years in the general insurance market. They're currently going through a very soft cycle. But in health for the last few years, definitely hard. But we are starting to see signs that we've reached a point where it's stabilizing. We've seen insurers lose significant sums of money, and I'll give you an example from Singapore, readily available statistics. So 9 of the top 10 insurers lost money last year. 1 insurer made money, and that 1 insurer was Cigna, who in Singapore do have a very connected system. The other 9 insurers lost $177 million in underwriting. So we've seen a shift from just absorbing that to now moving not only the pricing, but the benefit designs, the structure, the financing, and all of that's leading to a point where medical trend is starting to stabilize. You can see at the bottom there the 3 leading conditions: heart disease, cancer, high blood pressure. All of those cost a lot of money if you're on claim. So again, back to the preventative nature of things. Just on the left is the medical trend from the last 3 years. I've called out India because I'm here in India. It would make sense. You can see the last couple of years, fairly stable, 12%, 12%, and in 2025 it was up to 13%. Here's the global rates. So stabilizing, 9.8% across the globe. North America up slightly, Latin America up, Asia Pacific up, Europe and the Middle East starting to stabilize. And we can provide you with all the information that sits behind this on a geography and country basis. Closer to home, the region here, again, a slight increase year on year going into 2026, but you can see in the middle there, Philippines, Singapore, Vietnam, India, they're all starting to head in the right direction. And a lot of that is because of the work that's being done amongst the entire community to focus on the whole health ecosystem. definitely a trend whereby those bigger and more sophisticated markets are starting to get things under control. Just a view of what employees think, and again, we run a survey every year, which is an employee sentiment survey. It's all well and good talking to the market participants and the employers, but how we find out more about what's really going on is to understand what's in the minds of the employees. And again here, a lot of areas covered, but talent retention continues to be an issue, and I've spent this week with Ashley and we're having the same challenges within the business. Stress at work continues to increase, and again, I think I may have said this, that to me is the new pandemic. The cost as it relates to lost productivity, the medical impact of that, it really is phenomenal compared with what it used to be, and I think the global statistics suggest it's now running into the trillions of dollars in lost income. The interesting one for me is the top employee expectations. So well-being keeps coming up, benefits generally, and they're looking to the future now around retirement and financial well-being. I think if we carefully diagnose what's going on there, the generational change has changed in that, people wanted retirement, now they want medical, but they want all these things in between, such as work-life balance and flexible working hours and things like that. And all of those play into the underlying cost base that occurs. Impact of AI, that's coming up a lot in the conversations we have, and that's more a fear factor from people around, what does my job look like tomorrow? Will I have a job tomorrow? So I think all of these are coming into play as it relates to how the human being at the end feels. And as we all know, if you're under stress for anything, whether it's financial or worries at home, worries at work, it impacts your performance and your overall well-being. What I'd like to do now is just come back to the themes that Nick was talking about earlier. And I do fundamentally believe that there is a huge opportunity here in India. India's leadership in innovation. India is quickly emerging as a global hub for digital health transformation. I think in the last 3 months, I've been in a number of forums where India is the point of discussion because of how quickly they're pulling everything together. As it relates to the region, Singapore, the Philippines are very similar. They're very correlated in terms of the healthcare system and the participants that are in that system. But India is the talking point, and even earlier in the week at the Bupa discussion, India was referred to as an example of connected care. Again, Bupa's vision is around connected care, and predominantly because they own an insurance arrangement. They're not a listed company, they're more of a mutual by structure, so their money is their policyholders or owners' money, and they want to use it the right way, but they also have their own solutions in terms of hospitals, networks, clinics and things, and what they've decided is the best way to serve borderless health is to bring that entire ecosystem together, and I think that's exactly the theme of what we're talking about throughout today. Redefining borders, I think Nikhil touched on this earlier. Health without borders is not geographic correct. The biggest challenge that brokers and clients face in this market is mainly driven by regulation and legislation. So if you're going to place a policy, it has to be locally admitted, or what I would say is, let's put that to one side for a moment. We can always create an insurance solution. What we can't necessarily create is what the insurance pays for. And I think, again, this connected ecosystem, once that's been created and we know that it's working properly, we just plug the insurance behind, because it's just funding. People are looking at how they access their care, what that care does to them. Does it make them healthier and happier and more engaged, more resilient? If all those things can be provided, and I do believe that they can be provided in India with what we're seeing today, that makes the insurance job all the much easier. And again, from an insurance provider perspective, if there's data exchange and AI and there's systems in place, cost gets controlled. Nick mentioned it earlier around fraud, waste and abuse. So I think what I'm hearing here is that it's being done the right way around. Let's turn it upside down, stick the insurance at the bottom, get the entire ecosystem right, and then we could provide the funding. And the funding can then be provided to the entire 1.5 billion population, which is, that's a huge challenge. But it's also a challenge that we're seeing in Indonesia, the Philippines and other markets in the region where governments and regulators, they want to address population health because their own national healthcare systems can't cope, similar to what we know in the UK. The power of connected care, this is all around linking the entire ecosystem. And I think if you'd have asked me 20 years ago what a TPA was, going to the doctors and making sure I'm all right, but that means the Aon policy is not being used that often. But as I get more into it and travel the world and talk to people who are building these things, it's very clear to me that it only works if it's all connected. And we've seen so many people create a well-being solution here and an insurance product here and an administration solution here. They're all great. But as they stand today, pull it all together. You can still own the app or the idea or whatever, but if you connect and build partnerships, the result around the entire play moving forward will be much stronger, particularly for the people who are going to rely on this as we move forward. I think just the leading by example piece, reactive care to proactive well-being. Even if you just ignore the word well-being for a moment, reactive to proactive. An insurance policy will provide something that allows you to access a medical institution or a doctor or whatever. From that, you will probably need something, whether it's a course of treatment, some medical vaccinations or further rehabilitation. It doesn't matter what it is, it's solving for. We need to move forward is to think about the future, which is what's going to happen in the future. What is the data telling us? It means that you might have one condition, but through some form of biopsy or genomics or something like that, there is a chance that it may lead to something else. You can then get ahead of the curve, you can get the treatment or the tests that go with that, and we then start moving into preventative. And as my dear old mother said, prevention is better than cure. And in this case, it absolutely is, because the cost tail is sitting with the fact that people aren't getting ahead of the curve. They're dealing with the what is it today rather than if I change my lifestyle and my habits, I'm addressing the future and what it might be for me in the future. So again, it's a big message around the world, let's look at the future, let's not look at the now. Just some of the enablers of change. I touched on connected ecosystems and data exchange. Data is super important. Our partners, it doesn't matter which broker or advisor you are, we need our insurers, our TPAs to be providing data. Fantastic, but so what? It's what we actually do with it. It's what it's telling us, it's the advice we create and the decisions that we can help people make. So it's vital to have it, but unless it's connected to everything else that's going on, it's pointless. But I think in this system here that I'm seeing, data is moving. That's half the battle. AI. The right way and use it for the right reasons, and it has some very good adaptability across the medical system. It can spot things that human beings can't. However, balance automation with empathy. As a human being, we know that the entire digital healthcare system is changing. Great, but we still need people. People trust people. At this point in time, we're seeing a lot going on around the world on technology. They don't necessarily trust all the technology that's out there. They want to hear from someone who's going to tell them the facts, tell them the truth, and tell them what happens next. And even back when I was in the village, who was trusted most was actually the doctor. I think we need to get back to that. And when I talk about investing in people, we should invest more into the medical profession, because that's where the support will be required. Just global lens on India. There are a number of challenges around the world, as we've seen: cost, sustainability, affordability. But we are seeing technology solutions driven out of India that are being used all around the world. We know the Tech Mahindras, the Tatas, the Infosys, the Pros, they're sending people everywhere. They're working on technology. Whatever gets taken out of India is usually being adopted. So again, I think there's a huge opportunity here for the Indian market to drive change. The market will adapt and adopt that change. I know, speaking to Nikhil this morning and others, you have employee or user-based apps and solutions which could be deployed across the rest of Asia tomorrow. No problem at all. The healthcare systems are pretty similar. The networks and the TPAs are pretty similar. The end user's desire to have something that engages and helps them improve their health every day, that is there as a market. The challenge in those markets is the cost of providing those apps is 10 times what it is in India. If you can just export them over there with a small margin, because you've got some work to do, I think the adoption rate will be huge, and then the impact on people moving forward will be huge. Call to action. Clients, brokers, insurers, TPAs, networks, medical professionals, governments, legislators, and ministries of health all need to get connected to make this happen. I think the more we start to lobby or show that we're working together, the better the traction we'll get, the more support we'll get, because no one loses in this. Everyone gains. I think reimagine health benefits for a global workforce. Go back to what I said about insurance and borders. Don't worry about the borders. As long as the networks and everyone are connected and the data's coming into one place, the funding mechanism can be solved for. And then the comment again, commit to building seamless, affordable and trusted solutions and share with the world. Trusted is the important part. Share with the world, that's easy if you prove it works. So honestly, I think the concepts from earlier on when Nick was up here, what you're going to hear throughout the next few days, my experience of dealing with MediAssist and Mayfair and other organisations in a few countries suggests to me that the future is bright. We're going to have to do some work, but we're going to have to get together and make this happen. I think just a small phrase at the bottom, just paying the claim isn't enough anymore. We must be far more efficient using data, insight, medical advancement and partnership to deliver proactive outcomes to improve population health. I didn't come up with that. Someone else did the other day, but I think it mirrors really nicely with what's going to be achieved here today. So hopefully that gives you a few interesting insights. It's been an absolute pleasure to stand up here and talk to you today about what really is your topic to own and to deliver, but running a business across the Asia-Pacific region, I'm going to be a recipient of all the good things that happen, and I will be more than happy to support that as we move forward. So thank you very much for your time this morning and the opportunity.
Simon, may I request you to be there on the stage, please? I would like to invite Dr. Vikram Chatwal, Chairman MediAssist, on stage to felicitate Mr. Simon. Doc, may I have you on the stage, please, to do the honors? Thank you, Simon. Note, your emphasis on putting people first set the right context for our conversations ahead. We now move into our first panel discussions of the day, aligned with very heart of the summit, healthcare without borders. This conversation dives deep into how customer-first approaches are transforming health benefits, breaking down barriers, and driving seamless experiences. May I invite our dynamic leader, esteemed moderator, Shivani Sharma, National Head, MediAssist. Shivani, may I have you on the stage, please?
Sorry, give us a couple of minutes, please. Okay, I'm going to take the liberty, everybody, to just start while we set up parallelly. Thank you, Gigi. Good morning, everyone. I'm Shivani Sharma from MediAssist. Without Borders, a customer-first approach. We have an exceptional set of leaders with us today to explore how innovation is reshaping access, experience, and outcomes in healthcare. May I please invite my first panelist to begin the discussion. Siddharth Srinivasan, CEO, Lupin Digital Health. With a decade of experience in digital transformation, Siddharth Srinivasan is driving Lupin Digital Health's digital vision, including the launch of Live, India's first evidence-based cardiac patient engagement platform. Siddharth, may I have you on stage? Next up, with 20 years in India's general insurance sector, Surinder Bhagat leads the large account practice at Prudent Insurance Brokers, driving advanced employee benefits and wellness strategies backed by experience at ICICI Lombard and Marsh India. Surinder, may I have you on stage, please? Sushant Malya, SVP and India leader for the OPD insurance practice at Mercer Marsh Benefits, brings 25 plus years of expertise in insurance, reinsurance, risk management, and healthcare digitization, driving high impact strategies and transformative initiatives. Please join me in welcoming Sushant on stage. Shantanu Saxena, CBO at Aon India, brings 17 plus years of experience in risk consulting and insurance, leading broking strategy and performance nationwide. Over his 7 years at Aon, he strengthened global benefits management and multi-country employee health programs. Shantanu, may I have you on stage? Last but not the least, a co-founder and CTO of MediBuddy, Ambassador D has built scalable digital health platforms serving millions. Recognized in Forbes 30 under 30, he applies deep expertise in medical software and AI to advance accessible tech-driven healthcare delivery. I would now like to welcome Emba on stage. Thank you, Emba. Good morning, gentlemen. Thank you for being here. So, I think just to give the background to all of you on here, we all believe healthcare should be seamless, preventive, predictable, and deeply centered around the customer's experience, not bounded by legacy systems, paperwork, or fragmented journeys. Over the next 60 minutes, we will explore how coverage and health literacy is paramount for us to drive access, how innovation in technology is creating healthcare insurance products without limits. We would explore a powerful idea that healthcare should be seamless, preventive, predictable, and deeply centered around the customer's experience, not bounded by legacy systems, paperwork, or fragmented journeys. So with that said, let me just start the panel. And Surinder, if I may start with you. When a customer comes to you today and says, I want a comprehensive coverage, what does that conversation look like now versus, let's say, 5 years ago, and with you?
I'll share like what women want a set of question to ask, okay? What customer want is even more complex, okay? And but I must compliment Medisys team that the way you follow what customer follow is really amazing. Customer normally call 3 broker for RFP. You have called 3 broker for panel. So on lighter note, but I think I would just want to share one small Javed lines with you, which bring the benefit into context, okay? The line is that like that. सबका खुशी से फासला एक कदम है, सबका खुशी से फासला एक कदम है, हर एक के घर में एक कमरा कम है. So nice. Clearly, when we talk about benefits, I think that's the same thing which we see. Every customer want wider covers, more things which to be included. I think very clearly 2 meta changes which has happened in last 5 years, which has changed the entire benefit landscape. One is definitely COVID. Every cloud has a silver lining. So post-COVID, everyone has started realizing that benefit is extremely important component. We have seen that the myth that 4 members can't fall ill together, or we don't require hospitalization at one go, or I don't have a comorbid conditions, why I require a hospitalization. I think this myth has gone. The friction of using the virtual care, I think that has also gone down drastically, okay. People are extremely comfortable in using app, using GP consultation. So clearly, I think the 2 big changes because of COVID. Second big change which has happened is that in last year got totally unnoticed is that it's the first time where the Gen Z and the older generation are equal participant in the workforce. So clearly the benefit which were there for the earlier generation are not so relevant for the new one, and they are being a democratic process, so they have an equal share, they have an equal voice, and they are asking for more covers. So I think comprehensive cover is something which people are talking about. Clearly, earlier the discussion was 5 years back, was mainly on how I can reduce payouts, how I can out-of-pocket expenses which are there, how I can add more on the parental side, can I include something on the coverages which have not been paid by TPA, can I improve my wordings, okay? So primarily the discussion was mostly on the benefit side, the policy side, but I think the discussion now has moved from policy to the entire ecosystem. People are talking about preventive care, people are talking about the consultation, the pet care coverages, which in past we were not discussing that one. So I think it's not about only one part, but it's the entire ecosystem we are talking about, the entire ecosystem of care which people are looking for.
No, thank you for that. I think you've set the stage right. It's the 360 view that they need, and they need from all angles. And let me move this to Sushant now. And Sushant, with your experience, while I understand from Surinder what they need, but what do you think is some of the challenges that they have been highlighting now versus the earlier ones?
Hello. So thank you very much for having me here.
And has the
first.
challenges evolved in the last 5 years?
So challenges and what has evolved. I'll talk about what has evolved, because inherently we are in a use and file guideline also, which gives us provisions to kind of look at everything under the sky to be included. Right? So the opportunities, like Surinder mentioned, post-COVID has enhanced fair bit.
Fair.
flexibility is the key. While he spoke about host of benefits that, he spoke about Zenzi's, he spoke about pediatric care, geriatric care, all this is encompassing an inherent need for having that amount of flexibility for individuals to choose and pick what is important for him at various lifestyles, stages of life. Flexible benefit solutions definitely has evolved to that extent.
Sure.
I think post-COVID, inherently the preventative care model is something that has come at forefront. Going by the data and statistics, pre-COVID was or preventative health checkup, right? But all of this, from a behavioral pattern standpoint, the organizations have started to imbibe this more post-COVID, or maybe in the span of past 3 to 4 years that we have seen.
Right.
And all this to be integrated together is something that I think likes of MediAssist, MediBuddy together, or maybe our health tech partners who have come together. Health outcome is something that organizations are keenly interested. And today, I think there's a step forward. More than the organizations, even individual employees are also starting to ask for, preferred statistics in and around how they can conduct themselves from a health care standpoint, right? So I think to that extent, flexibility and choices that individual employees could prefer to have has gotten at the forefront.
Oh, thank you for well said. I think I would take the two keywords, the flexibility and choice out of that. And keeping that in mind, Shantanu, how do you think with your experience now, where do you think we'll be?
Okay. First of all, very good morning to all the delegates, and many congratulations to MediAssist team, Raksha Summit 2. It's great to see innovation and customeries as the subject. Frankly, if you have to look at future, the first thing is to understand the present and the past. The way things have evolved when we look at benefits, there have been products existing. For example, OPD, it has been existing forever. I remember early 2000 as a college part-time job. There were corporates that were giving OPD as a benefit. This is early 2000. Not mid actually, around 2010, 2012, when I was with Marsh, we were anticipating a new product line, and outpatient was again discussed. But it has flown today.
Absolutely.
And what this means is that the product has evolved at the rate more because of the access that it got, the technology interference that came in, network that was being created because of the same technology, thereby pushing the cost down, and hence, giving a package which was at today's level, it is beating P50, which means majority of the organizations have started to look at it very aggressively.
True.
So, if I have to look at the next 5 years, I would say that we have products, so we have the breadth, right? We have, and everybody has talked about fragmented approaches. So there are cottage industries, like Simon said. We have health tech players, we have a TPA, we have a wellness organization, we of course have insurers, brokers, hospitals, right? So we have the breadth side of it, maybe not fully connected, but it'll be great to see all of them getting connected. And then will be the vertical side of it, which is the depth. And that is where I believe technology and AI and our intent to really, and the resolve to solve for the end customer will play out. And that should come out as a very strong product, not just for India, and like Simon has already mentioned, for literally global audience. And At the heart of it, customer care and technology should really come in.
No, thank you for that. I think we have our keywords with us, from choice to flexibility to technology as an enabler. I think, yes, that's where we think it would be. So moving on, I think, Siddharth, I'm going to use some of your corporate experience and lean on that. What I would like to know is, where do you think the corporates actually look for? Is that what you think? And where do you think we would be from their asks and their expectations perspective?
Everyone knows what Loop in Digital Health does. Let's spend maybe 30 seconds on that. We started out wanting to predict heart attacks and prevent heart attacks. We did India's largest trial in this space, published evidence in top global journals, and started working with practically every hospital network in India as a post-discharge care partner. Having done that very successfully for 3 years, we then felt that we could perhaps extend the solution to insurers, to brokers, and to employers. And I think that's where, over the past 6 months, my colleagues and I have had these discussions with corporates. I think I would break that down into 3 things. First, corporates believe that it's very important that we stratify risk. It's not possible for them to invest at the same level for every single employee, whether he's a 21-year-old engineering graduate or whether he's a 55-year-old who's been with them for the last 30 years and perhaps has already had a cardiac event. Nor is it fair. So if you are able to stratify risk, if you are able to identify who needs what kind of care, more purposeful investments can be made. So I think, like the other panelists mentioned as well, corporates aren't afraid of making investments. They just want to be smart about it, right? And I think that's the first thing. So what we do with some of them perhaps is to stratify risk, identify those certain levels of maybe personal hand-holding versus others who require maybe technology-based help, and some others who perhaps just require education from time to time. Having done the risk stratification, you actually have to work on risk reduction. Right? Corporates want to see outcomes. They want to see reduction in loss ratios. They want to be able to see that their employees are actually getting healthy them for it. And therefore, having effective evidence-based programs, not just voodoo, I think becomes extremely critical. And I think the last piece is engagement. I think everyone realizes that, especially in predictive health, engagement equals outcomes. Right? If the member, if the employee is engaged with the program, they are likely to do well. One evolution that I think we have seen is a lot of healthcare, health tech model and hope that not more than 5% of people would use it. I think that identify those 5% of people who actually need the higher level of intervention, but then engage them fully, utilize it fully. I think that positive change is happening and will continue to strengthen as we go ahead.
No, thank you for that. I think well said from a corporate standpoint. That's what they're looking for. And it's the aggregators and the wellness partners who need to now absorb that and I think to tweak that. And keeping the mind coverage in mind, but moving on to you, as a wellness, as it has become central, how do you see playing a part in this truly limitless and seamless journey of customers?
See, wellness is very different from how healthcare has been delivered so far, right? So wellness starts, with, of course, millions of touch points every day, right? Every day we step out of the home, drive through traffic, reach office, work whole day, and then drive back. There is every touch point, right? Be it pollution, be it the interactions with your, providers, other fellow citizens, and so on. So it starts from there, the preventive or the everyday aspect of life and how it affects one's well-being. So hence the way to look at it is very different from a hospitalization or a procedure or a secondary or a tertiary care. So this mindset shift, this problem approach itself should become unique. So there is a journey from wellness to primary care, then eventually to secondary care. The second aspect I want to also highlight is it's a multi-year journey. Sometimes there are incentives or short term, so hence decision making also typically runs year by year, right? Whereas a change in behavior or change in habits or even how to think about long-term, short-term bets and initiatives become very, very critical to view in that lens. So prevention doesn't happen in 1 day, 1 year, 1 week. It happens over many, many years. The third aspect I want to talk about is we also live in a unique time and space where a typical workspace spans across many generations. So what a new employee who's a 20-year-old, 22-year-old looks for today in this world of AI, in this world of digital, is very different from what somebody in the previous or a couple of generations behind is going to look for. So it's also important to be able to solve for all of them at the same time, to be able to cater to a wide audience within an organization. And so that's where it's critical that we have consumer thinking, we have a provider understanding, as well as the care and the bigger decision makers and stakeholders are involved very much in this process to solve problems for preventive health.
No, thank you. I agree. And I think that is something that we need to work. While I know coverage, we've moved to the wellness, and I think that is something that all of us are focusing towards preventive. Even Simon spoke about preventive is better than. But I think still there is 100% of the coverage which is with our hospitalization and the legacy methods. And going back to Surinder, to you, where do you see challenge in the current products? Any specific challenges that we need to overcome in some of these legacy products that we are in? While preventive is one part, but how do we overcome these exact 100% coverage with everybody once where most of our customers lie?
I think one data point which I want to share with all of you, that surprisingly, post-COVID, we talk a lot about benefit, okay? But on retail space, 20 million policies are static for last 4 years. Individual retail policies, okay? So clearly in a country where penetration is very low, I think Nikhil talked about that we need to reach health for all by 2047. We need to grow at much faster pace, but the volume has remained static, okay? Clearly, this shows that the product level, I think the customer response, maybe it's not that great. Maybe he's not seeing the entire value proposition which we are offering to them, okay? So I think clearly we need to relook into the way we are designing the cover, the way we are offering the cover to the consumer. So I clearly see a gap. Again, I think one more thing which normally if you look into, I think the motor insurance, okay? I think it's an interesting thing that almost 98-99% cases are on cashless basis at industry level. So on motor level, they have been able to resolve this issue. They have been able to remove these frictions away from the system, and consumers see a value, okay? And in healthcare, I think still we are. I think I started 20 years back from 45-50%. Now we are back to 70%. But still, there is a very big distance which we need to travel. Okay, I think every TPA, every broker data to a consumer will talk about cashless 98%, 99% in 2 hours. But I think if you go to employee or consumer, the experience is not the same. I'm not saying this is purely our issue, but I think as an ecosystem or as an entire healthcare access provider, we need to relook into this entire thing. So clearly, I think the product has to evolve, the services has to evolve, the frictions has to come down. I think the ping pong, so customer is looking for a care, what he gets is a process. I think that is one area where we need to definitely look into this one. I think long time back, we saw a movie, Munna Bhai, MBS, where he talked about that अगर documents submit नहीं होंगे तो you will not admit the patient. But I think somewhere I think the reality is still there. Okay, I think at a corporate level we have been able to evolve a lot. It's still a long journey to travel. So I think these are the areas where I think we need to look into and how we can make it more interesting and more innovative for a consumer.
No, thank you for that. I think it makes sense. Those are some things that we need to concentrate on. And while we are on coverage, and I think we've now discussed how we need to increase, what we need to increase, I think while having it is all the second challenge that we all face is, do customers even know it? Is there a literacy around it? Do they actually, at a point that they need it, is it available to them? And some of you who's, part of the journeys are actually developing platforms, tools to make sure that the customer gets it. Shashank, back to you. How do you think as Marsh, you would contribute to the customer health literacy journey, and how would you be able to, how are you planning to go ahead and increase that, in which all of us get a lot more comfortable with the percentages that we see today?
Which probably is barely 40% is your hospitalization.
Yeah.
That's what is visible.
Right.
But that's barely 11 to 12% on a frequency, which means in a corporate, there will be one person after 11 years claiming again. Right? I mean, typically. What you miss is the base. It's close to 60%. That's your out of pocket.
Yes.
OPD, which is inherent. Now, typically, what's OPD? Right? And you'll have to go back. You look at classic situations on your property casualty, you have assessments, risk assessments that you do. You also buy AMCs.
Right.
OPD is an AMC on health. You invest on preventive care. So you avoid funding your illnesses, right?
Yes, that's one method.
That's pure literacy.
Yes.
Was it not made known, or didn't people know about the importance of this? They knew, but probably they waited for a phenomena, and COVID was one. Did a lot of bad, but I think what progressively did the best was this, that it brought in the need of primary care and preventive care for, at the forefront. So it's extremely essential that we invert the healthcare pyramid. Look at OPD first, your preventive care first. And look at hospitalization only when it is, extremely important and required. Unfortunately, you don't have a healthcare regulator here, right?
Yeah.
But the beauty of this ecosystem is you have health tech partners in abundance.
Yeah.
We have the best ecosystem. We have a classic situation of having the 4 largest public sectors with us. You have general insurance companies. You have Sahis with us, right? Technology is at its peak. The best UPI is in affordable cost is made here. Digital infrastructure is growing. What best situation you can be at this stage, right? It's one of the most cohesive environment to be in, to fuel this up. What is essentially important is how this entire segment integrates into health outcomes, so that we give all stakeholders relatable data. I mean, on an IPD side, right. We all know, right? We probably are doing pseudo self-management or self-fund management, and that's where they have been supporting. But then tomorrow, if I get all this data together and I park, right, it becomes extremely essential. So what we at Marsh have done, we stepped back, published 3 white, voiced the customers' preferences. We went back to our insurance companies to ask them about how do they feel to come at the forefront and underwrite this, right? Because gone were the days, I think a couple of insurance companies attempted to do underwriting on preventative care model, but then they decided that, this is not going to work. But when we went to health tech partners, they said, yeah, we have been able to provide all that you want. When we integrated all this and stitched into a fabric to aggregate, like Chantanu mentioned about fragmented to I actually went to the UK to submit a white paper on preventative care model and India as a case study. And they couldn't believe that all this is available here. And I did it in Actuarial Institute, right? So when I told that there is science behind this, and we have designed a calculator, Shivani, as we speak, and we've rolled it out. This actually gives you synergization between IPD, OPD. It gives you indexes in terms of engagement strategies amongst employees. It gives you, if you in a sustained manner invest in OPD, what's the outcome on your IPD side? How many days on hospitalization can get reduced, and what's the cost saving?
Awesome.
So this is overutilization of 3 million health utilization data points that we had. So I think the case is there. It's just about how do we want to play the game right.
No, fair, understand that. I think, again, bringing out important points, data is one. And yes, I think as an industry, we've realized that we've reached a stage of using preventive care where in a moment of 3 to 4 years, there is some enough data for us to at least start linking to hospitalization. And that is something that would probably impact what we've been trying to impact for some time now.
In fact, I had a chance to discuss with Nikhil and Satish. I think as MediAssist, you have been traditionally settling OPD claims and preventative care claims for God knows so many years.
Yes.
But how do you use that as something that we probably would want?
No, so let's talk about it. That's a segment I have because while there is an expectation on data, I think what kind of data and how we have and how with wellness we'll be able to aggregate. So I'm going to touch upon that, but just to stick to the topic, Siddharth, from your perspective, and I think while Sushant brought out some important points there, and especially OPD impacting the IPD space, I think you've done some phenomenal work in terms of some of the case management and specific management schemes, conditional management schemes, which helps in actually clearly see the impact on that. What has been your experience around it?
I think we found is the real secret of being able to make this work is to try and reach out to people at some moment of truth. When we work with providers, that's very easy because our patients have gone, touched the face of God and come back, right? And when they're lying in that IP ward, having their life saved, it's very easy to be able to talk to them about what they need to do next. Thankfully, most of us have not been in that situation, and therefore we need to find another moment of truth. What we found is that the annual health checkup and that PDF document that comes thereafter, because you get a whole jumble of numbers, you traditionally know, you don't know what to make of it, and you forget about it. But if you're able to translate that into actionable intelligence, so we have an evidence-based heart age, we're able to tell you why your heart age is more than your actual age. Some folks were genuinely flabbergasted of how high their heart age was, and we also give them way to reduce their heart age, bring it closer to their actual age. So I think delivering that kind of message, that kind of education with that moment of truth, I think is really helpful. And after that, you have 2 weeks where if you are able to hook the guy, he continues. And if you lose him, you lose him forever, right? And that's where I think having clinical AI, having a very engaging app, having gamification, all of that helps. But it comes from fundamentally trying to understand human psyche and when you think you can be most effective. And then, of course, all of the bells and whistles. What we pride ourselves in is the fact that traditionally the link that's broken is you do all of this, but when you go and talk to your doctor completely disowns all of this, saying, I don't believe in all of this. You can either believe the app or you can believe me. Because we work with almost 80 different hospital networks across India, because we work with more than 5,000 clinicians, chances are your doctor also uses our platform to maintain his network and his patients. And that becomes a far easier conversation for that particular person to say that, I'm using this at work and I can also use that to stay connected to you. So I think being able to connect that entire ecosystem is obviously very, very helpful. But being able to hook the employee, I think, is really helpful. One piece of advice I would do is don't do webinars. It doesn't really work, right? It's a check the box item. If that was the intent, I think it works. But otherwise, layer it onto existing habits. The annual health checkup is an existing habit. Layer a smart report onto that. Layer immediate actions on top of that. And you will be able to see sustainable results.
Amber, Siddharth has given you a cue. And as per him, we should not. So just going back to you and you being the CTO, how does your wellness platform actually enables some of those things and actually increases the knowledge and awareness in the customers?
Sure. Because of the scale of touch points that I briefly talked about,
there is no option other than trying digital means, right? Because everything else becomes prohibitively expensive. So we also need, to make sense financially for it to be able to adopt it at scale. So at Medibuddy, we serve, millions of users every month. Hundreds of thousands of people open the app, interact. Okay, how other consumer products and how do you adapt it to healthcare becomes very, very key. And second, of course, understanding the end user becomes very, very important. What is the persona? Where do they come from? What language do they speak? Where do their parents stay? How do they view healthcare? Where are they in their financial journey in terms of their career? So there are many aspects that go behind building a good consumer experience, and how do you adapt this to healthcare becomes very, very key. It is how do you make it more engaging, how do you make it more fun, how do you make it rewarding, how do you make sure there are, while healthcare is a long-term journey, how do you create short-term milestones which are achievable, easy, and give the right feedback loop for individuals becomes key. Second aspect that Medibuddy the right amount of visibility for every stakeholder and decision maker involved. It could begin from the providers to the payers to the end user themselves, because nobody wants to, is the biggest beneficiary of healthcare than the individual involved. So we also continue to focus on all three dimensions, and how do we bring all of this together becomes very key. Third is keep following customer, right? Like where do they spend time on? Like we talked about annual health check, but it's a once a year touch point. Maybe, if the results come bad, I'm slightly more focused for a week or two, but then what happens beyond, right? I just go with the life, and life moves on, and I visit it. Hopefully, maybe next year is the best case scenario. Whereas how can we increase the touch point becomes important. Let's say more recently we launched vision care, right? Like something that most of us end up, wearing, especially in our lot of the jobs in front of a laptop. We all end up wearing spectacles and stuff. There's another touch point that increases this, right? And vaccinations, another touch point. And so while these are transactional, like the gentleman mentioned, it's important to move the users through this, and directly we cannot jump to the last step. So how can we incrementally increase the number of touch points and therefore have an opportunity to engage meaningfully with the individuals is what we are proud of building. It's a very challenging problem, but we believe we are making significant progress there.
No, thank you for that. I think while we might be speaking about all of these pieces in one feature, it's the journey which helps in healthcare. It's not just one point that you need to track. How you're actually managing the whole life cycle is what would matter. And that is what would lead in the end also to the hospitalization, where you would be able to track each of these things to actually get to a point that the person does. So, no, thank you for that. We've spoken about coverage. We've spoken about how do we increase health literacy. Moving on to the, the most important things. We know what else. We need to know how, right? I think it's very important to see how do we innovate to actually, and, some of us spoke about technology being an enabler in the beginning, and what should we do? So, Shantanu, very, very large question for you, but how do you think, what should we innovate moving from the sickness to, let's say, preventive healthcare? And what is the biggest impactful innovation that you think would lead us there?
So, first, what is important is to understand what exactly is the product going to be, right, before we start looking at innovation. And at the heart of it, I think we need to keep in mind that we need to make something, innovate something for the audience, keeping their needs, their preferences, their conveniences as the core of the product. And of course, with that, you give them more transparency, more personalization, and a touch point of care throughout the journey of their healthcare.
Sure.
So basically what I'm saying is that we need a Jarvis of Iron Man to be provided to every individual so that tomorrow, from moment somebody gets up, there is engagement which is available, there is empowerment, We have applications which are gamified. We have rewards so that there is behavioral change. We have integrated pretty much all of our stakeholders into a single application, which is giving them more access, easy access. And in the end, I think we have to move deeper into ensuring that all of this data is getting used by, like I quoted the term Jarvis, right? Jarvis is basically AI, which is supporting Iron Man. You need a personalized, AI, which is going to read into all of that data and have predictable, manageable, sustainable future and outcomes presented to that individual. And that should be the vision, and that can only come in when all these stakeholders, they understand and work on enriching the data. Something as simple as cashless. Okay, it's been the first cashless that I can remember, and MediAssist has been a pioneer in this, is what I can recollect, early 2000 again, maybe late 90s. Since then, more than 25 years, same hospitals, same insurers, pretty much similar top 10 diseases, but we have not been able to improve on the employee experience or the customer experience to the level that we all want. And I'm fairly happy that today, we are all, Nikhil was of course talking about it, that is an attempt and a long attempt this time to simplify it and to put it to ease. But frankly, I believe there is this communication distrust or breakdown which is preventing us from delivering this. Otherwise, I see no reason why for 25 years, when we know that, that this is the process, we are unable to standardize it. And maybe it is the human body which is complex, maybe because of that. But as simple as, like the Munna Bhai dialogue, form to nahi bharna padega. I know even today that discharge is getting delayed because you don't have a signature on the discharge summary of the doctor.
Well, yes.
Right? So you understand, right? So all of these things need to be addressed and ensured, and you, MediAssist specifically, and tech partners responsible at the networking side of it, are at the cusp of it to really make that change and deliver. I mean, we as brokers, we understand and we get you the problem statements and we try and solve them also to an extent. We can all try, but ultimately each of us will have to really, get deep into it and solve.
Absolutely, and I think, thank you for that. Each of us have a role to play, and we need to, and you're actually leading us to the next segment, where I think you would get some of these answers. And to be honest, it is a fairly complicated problem. Between 5 stakeholders, I have 2 stakeholders on stage today. We still have 2 missing. And if you get them on the stage, you can imagine the jamboree that we would create. And each cashless is one of them. I would like to have a Jarvis for myself, and that would be a day that I would like. So Sushant, just going back to you, as in your consulting role, how do you think, what is it? Is it easy to sell a product or difficult to sell a product? Is cost a factor in our country? While we speak about experience, while we speak about all of this, do you think cost is a factor that people look at?
Yeah, cost definitely is. And there's no denial about cost being an integral aspect. but it's extremely essential to, like your first question to Shantanu, think innovative. And innovative has no boundaries, honestly, right? If I have to think innovative, we thought about a full-blown policy to a policy which has deductibles and co-pays. Right? What does deductibles and co-pay mean is having the skin in the game. Right. Because again, you don't have a healthcare regulator, you don't. And you are also constrained in, all of us are constrained in our own limitations, right? So how do you actually program the client to think innovative is all these strategies, right? And it's not, if you're imposing a copay, it's like coverage slashed or something of that sort. It's to actually look at how do you avoid wastages and abuses, right? So this inherent is going to impact the overall cost. You're talking about medical inflation, etc., etc. But I think we are yet scratching the surface on basics, right? If I am talking about cost, it's extremely important that I also bring in the behavioral pattern of employees to do the right thing, right? I will have to go back and have some dialogues with corporate clients to tell them the reality on ground. I will have to have the support of my insurers to go back and say they don't undercut each other. Right? These are all facts. So you have a point where you have a couple of insurers who still would prefer to do something at some price. But who is bearing the brunt? It's a myth. It's a big myth. The end customer is never getting what he's paying for. Right? So where is all this going? So innovation is not just to say, oh, we innovate in product, we bring in so many fancy stuff. I think innovation at its core is to think rational, not fall for the prey of peer group benchmarks, what somebody else is. The whole world is doing something doesn't mean that philosophically that's the right thing to be done, right?
Right.
So I think tough questions with stakeholders together have to be asked. I think I was just hearing my friend here on the journey. It's not essential that we start giving them something which is like, I think, why should I give a variable? Why should I talk about dental vision? These are all cash components. Right. How is it going to affect the occupational health risk? It's not. Right? Dental is not going to do anything. Of course, vision could possibly because it's directly occupational hazard. But I think in the journey of the life cycle, an employee should feel engaged. You have products which insurance companies have designed which gives you 100% remittance. Looking at something like a CIBIL score for individuals like us and say, you need to have a health score. And basis the health score, you get 10 different things, right? Privilege in the market. I think that's where we need to think, and it's not far, honestly. If we think together, this is possible.
No, thank you for that. I think that's a very, very new way of looking at cost and innovation together. Because while we can all talk about cost, finally you need to find ways in which you can mitigate and actually still deliver a value to the customer and ensure that that's used in the most basic manner. I think one of the other things from an innovation perspective, and Surinder, this is to you, is I think we see a lot of innovation that is required while it is still there in our minds from a technology integration perspective. And, as Shantanu mentioned, that there are challenges, right? And there are 5, 6 of us in the ecosystem. Do you think that is something that, you guys are looking at, or is it something is there an innovation required from technology standpoint there? How should we approach that?
I think one thing which I want to talk about is, I think famously Martin Luther has said that I have a dream, okay? So I think even I have a dream that we can change the concept of the policy as a first level, okay? I think if we talk about property insurance, we talk about the embedded insurance, market has moved from defined inclusion to defined exclusions, okay? Where clearly policies say that whatever is not being documented here is being covered, okay? I think finally we can reach that space. I think I clearly see that when we talk about the consumer is standing at a hospital because of a 5%, 6% non-payable items, which are variances 1% only. He is standing there because that value has not been defined, okay? So I think clearly we see frictions. We clearly see that in spite of paying 3.3 crore claims at industry level, okay, and payout of almost more than 1 lakh crore, which we have paid, and normally rejection rates are less than 5%, okay. In spite of that, I think on regular, if you see NPS, okay, I think you track NPS very closely, okay. I think we fare really bad on lower than hospitality, utility, telecom sector, whatever. So I think clearly with the right kind of integration, with the right kind of innovation around the process, I think we can change a lot, okay. I think clearly I see, let's take example of a DG Yatra, okay. I think the security level, the concerns are even more severe compared to 10,000, 5,000 rupees here and there, okay. I think they have been able to crack this code, okay, where they, based on technology, based on integration, every one of us use that very smoothly, okay. I think here also, I think we need to look into the areas where I think how to ensure that a person is able to check out without having a delay. How he, whatever is payable and non-payable, he should be able to know well in advance rather than waiting at the last moment and getting a surprise. I think these are the things which are required. I'm very sure that we are moving in the right direction. I think I can talk about that 7, 8 years back or 5 years back, getting a third baby covered was a issue. Now getting a fur baby covered is also a solution. Okay. If we talk about, let's take example that getting a name change endorsement or age change endorsement was a complication. Now even sex change endorsement is possible because of gender reformation covers which are there. Okay. So I think we are moving in the right direction. I think with the right approach and with the right kind of investment. I think one question which you asked on cost side, I think where I definitely want to talk about this, that as a cost, as a narrative, I think we have discussed a lot. Okay. But if we talk about any large corporate, okay, the healthcare spend is less than 5%, 0.5% of the payroll. Okay, definitely the packages help you to attract talent. Okay, but to retain a talent, you require benefit. And with a 0.3, 0.4% of spend, I think definitely cost. I think more than cost, I think the meaningful benefits are more important. I think cost is not that's something which we should talk a lot. Okay, I think there is a very clear under investment from a corporate side. Rather than over-investment and inflations are impacting them, it's the other way around. I think where we need to look into that how we can offer covers which are more meaningful. Shashank talked about, I think, OPD, which is very, very, I think, interesting thing that how we can reduce out-of-pocket expenses. But I think the biggest issue is severity. I think 10,000 rupees, 15,000 rupees impacting you and me, we'll be able to absorb this shock, okay. But when we're talking about a claim which of 30 lakh rupees, 40 lakh rupees, that can put a serious dent on anyone's pocket, okay. So I think one small thing which I want to share with you, I hope I have time around this, excuse me for this one, but I think like we quote real GDP and nominal GDP, okay. Nominal GDP is real GDP plus inflation, okay. And no one quote kya kehte hain real GDP because the growth is very, very low, okay. We are growing at 7%, but on real terms we are growing at 1 or 2%. I think sum insured, we are talking about sum insured of 5 lakh rupees, okay. I think when I joined, it was 5 lakh rupees, currently it's also 5 lakh rupees. The market median. I think if this is again nominal sum insured, this is not a real sum insured. Real sum insured has gone down to 2.5 lakh rupees. So I think this is also one area where I think we need to address and think a lot as a community.
No, thank you for that. And definitely, I think adding on to what Sushant said really makes sense. And I think while cost is something which can be mitigated and which we need to take care of and we need to find a value creation with the corporates, a product innovation in that space, ensuring that makes sense for the corporate would help. Just a last question on that with Emba to you. I think, how do you and how are digital tools removing the traditional limitless? How are you guys moving from wearables to apps and everything and ensuring that that innovation helps in all of this journey? While integration is one part, but I think there is a lot that is happening outside of that also, which needs to ensure that there is a limitless journey from a tech standpoint and innovation standpoint.
Yeah, sure. See, there is of course a large opportunity to solve problems here. Sometimes when we see a lot of problems, it should not be discouraging, but rather encouraging in terms of an opportunity to reimagine. So we're definitely excited about what we are building, and of course with AI advancing, and there is a lot of opportunity to do things at lower cost. While it's still emerging, there is rightfully skepticism around what the tech can do. I am a strong believer that it can emerge into at the forefront of what we're building for and solving for. And digital is a way of life for every one of us, right? And in every aspect of life. Probably health is a laggard there rather than a leader when it comes to digital adoption. Today, without our mobile phones, without an Ola, Uber, or a Flipkart, Amazon, or a Blinkits and whatnot, our daily life is, cannot be imagined that way, right? Although it's like very recent. So it's an opportunity because now consumer behavior has changed. So it should be far more easier for us to drive unique value propositions, create right behavior changes, so that health becomes an ongoing journey for our users. And second, data becomes again key. While the cost of data is still a challenge, how do you acquire data is a challenge. And healthcare as an industry, are they still adopting digital tools is also very, very important. Today, as a platform, we aggregate information from many health partners and platforms. For example, we work with over 10,000 plus diagnostic centers. So the kind of lab reports and the variations we would see across each of these locations, right? From even a language, there are reports in Hindi, right? Not necessarily in English. There are prescriptions that are still handwritten even in an urban location, and medicines and prescriptions led, medicines is still rare. You can still walk up to a pharmacy and buy medicines without prescription. So adoption of right technology across all of these segments also becomes key. And that's why we're driving. So it's not about this data is readily available for us to integrate and pull, but it's a behavior change across the ecosystem that needs to evolve. But rightly pointed out, right now the time is ripe. Almost every facet of the customer interaction at every touch point has changed. So I'm definitely hopeful it's going to be, the next couple of years with health is going to also see this change.
No, thank you for that. I think that rounds up well in terms of ensuring that we have all stakeholders contributing towards the data in a manner that all of us can actually consume it and actually make sense out of it. So thank you everyone. I think before I close, and just as a statement, and if I just give you one sentence to actually go ahead and say, if you could design a healthcare product, insurance product, with absolutely no limitations, truly without borders, what would it include? I'm sorry to putting you on spot, but let's just do it in one line. Shantanu, over to you.
So I will coin the idea of care, and each of these can be then defined. So C will stand for cost. So to ensure that it is viable and properly priced, so that it reaches the masses. A will be for accessibility, AI, and ensuring that you're able to give enough options to people for their personalization and transparency. R will be rewarding from a behavioral side, because I also believe that I don't want to say it like that, but South Asians are a little lazy. We are not very, while we want to talk about it, but we are not really concentrating enough on our health and our diets and etc. So maybe an entire journey of maybe if we reward them to be healthy, there will be a shift in the way they perceive healthcare themselves. And E will be empathy. So yeah, I think the core of it will be care, and if we can combine all of this, I believe it will be a strong product.
Awesome, thank you.
Your health advice to be as real time as possible. Micro consults. So every day that you sit in the wrong posture at your desk is a day leading up to cervical spondylitis, like I have. Right? So there is a threshold where you may not even want to go for an OPD, but can that be brought to you in real time? And I think clinical AI can do that.
Sure.
Secondly, you want it to be as engaging as possible. For all of us in health, our competition is not each other. Our competition is Instagram, is Swiggy, is Zomato. So you're fighting for attention. So being able to engage, I think, is extremely crucial. And I think the last one is being integrated. So being able to connect the provider, the payer ecosystem, and being able to ensure that there is a seamless journey, I think is what we're all going for.
Absolutely. Thank you for that. Shant?
I think, personally to me, the Indian insurance side story should look at a product which should start with primary care,
Okay.
and get to, that's on the product side. So you have the primary healthcare as port of call and get to severity when it is required. That's number one. Number two, it's extremely essential that we get all this together. When I say get all this together, thought on and again innovation side, and I keep deliberating with SK most often, is can we design org level a fabric, something like a social media, which can be designed, within that organization which will bring out preferences clearly.
Sure.
Why do you need product innovation for somebody to look at using those?
Right.
If I know my friend on the other side has actually gone for a primary healthcare, preventive healthcare checkup, and he says, oh, this was fabulous, I did it through this, it was phenomenal. Within 10 seconds, I got the appointment, I was out, right? And I had a green channel, I had a red carpet. I am tempted. These are all taboo-based systems, right? I'm good with not doing a health checkup, believing that I'm good in health, right? That's the situation we are in. So I think, can we go ahead on the technology side, stitch a social fabric within organization and then eventually the larger scale? It would also help in reducing the number of touch points on the networking side also. You don't need so many.
True.
Right? Including the third-party administrator, Shivani, you know, we have been discussing on preferred provider networks, etc. You use limited, but you want to see numbers.
Agreed.
So can the same logic prevail here? And the last thing is how I look at health outcomes and really make it relatable to the end customer. I should know where I am standing. That's most important. Forget about the organization or anybody else. And then when I know, can I claim rewards on good health for myself?
True.
Right? So I think these are the 3 points I think.
No, makes sense. Surinder.
So I think I like to bucket them in 3 C's. First C is definitely the construct part, okay? The policy should have the no limit kind of a design where based on my requirement, I should be able to use that. I think we have seen many examples in multiple corporates, the impact on claim is not that severe, okay? So clearly, without any limits, okay, again, the sub-buckets which we see of a IPD, OPD, mental, multiple other things, should be a unique, seamless experience for the consumer. So I think clearly on construct side, we can look into something which is more, less restrictive and more holistic. I think that is one very clear C. The second C is consumption. When I go to the hospital, when I go to different places, it should be easy check-in, easy check-out. I don't have to segregate the bills based on different buckets. The providers which are there, broker, TPA, insurance company, they should be the one who should be helping me out in this one. And third C, on lighter note, enough commission for me and you. So we offer the right covers to the consumers and give a right kind of experience around that. So I think all 3 are extremely important. Last C is my favorite.
Makes sense. Thank you. Emba, last word.
Yeah, I'm looking forward to, of course, solving, consumer-centric problems. In this case, it could be an employee or the person whose health is the point of discussion here. And very rarely that person, the stakeholders, when we are discussing and solving problems. So increasingly being conscious of it will definitely make us, solve problems that are long-lasting, that are in the short term and the medium term, both beneficial to the individual, the organizations, and the stakeholders involved. So I'm excited for that. I see this increasingly happening, and forums such as this is definitely a hotbed of such conversations, and I'm excited about this for the future.
Oh, thank you for that, and I think that's what we did. So, thank you, gentlemen. Thank you for this. I think some of the key words and some of this, I think summary and some in short, and I would take cue from all of you. That thank you for using real time. I think that is something that we really need. And that is what makes us take decisions immediately and time that we actually need to. And Sushant, I think from a cohort-based, community-based social network fabric that you're talking about, I think that would give, one, it would give somebody what they actually want and need and what they understand. And two, I think from a provider and a service standpoint, to mean that we are able to go ahead and service him in the manner that he needs. So the choice gets covered. And so, that I think would be something that would work. So no, thank you for all of this. And I think from coverage that adopts to real customer needs, health literacy that empowers people instead of confusing them, an innovation that predicts, prevents, and personalizes in real time. Integration, Surinder, that makes healthcare feel like one journey and not many. And wellness that shifts us from treating illness to sustaining health would actually deliver the care that Shantanu has spoken about. So thank you for being with us. I think it was an absolutely delightful thing to have you here, and thank you for all your thoughts.
Thank you.
Thank you.
I would like you, I think Gigi is there. Please.
May I request all the panelists to be there on stage, please? I would like to invite Dr. Vikram Chatwal on stage, please, for felicitation. Thank you to all our panelists.
and try to sort of imagine a future which is slightly different from how it is today. So since I'm now the CEO, you will see more of slides and less of tech, but hopefully you will stay with us active in the next 15-20 minutes and allow us to share how we are thinking about the future of healthcare delivery in the country. And of course, I think for those of you who've seen the knowledge report of Raksha Summit last year, it is, at the end of the day, if you want insurance for all by 2047, that's our target, they're to solve as a country. The benefits have to be sustainable. You can't have insurers making losses. You can't have runaway costs and inflation. And the experience of the membership has to be super effortless, right? Without that, people are going to lose faith in how insurance actually works today, right? And historically and worldwide, these two are seen as objectives that are typically at conflict with each other, right? It's hard to focus a lot on member experience without sacrificing the sustainability and vice versa. So here is where we are as we speak today. Okay, that's good. So you heard some of the numbers that we spoke about are 85% today, and you will hear more and more and more of cashless in all of the conversation, because we believe that the member reimbursements are a crime. Nobody should be 100% out of pocket. Everybody should have universal access to cashless healthcare. So these are metrics that we very consistently track. About 85% of our cashless today is electronically submitted by the providers. Right? 70% of the value of claims that we process today are cashless. And by the way, 62% of admissions and 52% of the discharges today we process in under 30 minutes. Today, right? So that's the focus on cashless that we today stick to. Now we spoke about sustainability and we spoke about effortless, right? So where have we been on the effortless? Today over 15% of all our monthly discharges that happen, people are walking out of the hospitals before the bills are generated. And we're not figuring out what the cost is, we're not figuring out how the policy terms and conditions apply, we're not making people wait, but people are actually walking out of the hospital the moment the doctor says you're good to go. And it's not limited to 5 hospitals, 10 hospitals, it's not limited to a couple of procedures. 4,000 hospitals and letting over 35,000 patients walk out of the hospitals. Which was way higher than what it was previously and already running at a 50% higher run rate as we speak now in the current financial year. And the other metric that we take a lot of pride in is managing the cashless inflation across the MediAssist portfolio, where we manage nearly 21%, excluding Paramount in that business. Our medical inflation for H1 was like 4% against all the inflation. How did we do? Now let me just spend a moment on the effortless side of it. What did we do in the last 1 year? We launched 2 independent capabilities. One is called the Navigator, the other one is called Prime. And what are these? So Navigator today allows somebody who's planning a hospitalization to put it and get a reasonably detailed out-of-pocket estimation even before somebody checks into a hospital. And the out-of-pocket estimation, oops, okay, sorry, that's not tech, right? Okay, the out-of-pocket estimation Today, 20% of our membership click on that link and figure out what their out-of-pocket expense estimates are. But what's more interesting is 40% of those who use the tool change their choice of a room type. If I had an eligibility where I could use a single room, not a shared room, and I would actually go back and change my actual choice when I get hospitalized, because then my out-of-pocket is within the limits of the policy. Maybe we give them 30 seconds and switch to plan B. Just give me a moment. Right. So, all righty. And by the way, not all of the 40% is a downgrade. There is a finite percentage of those who also upgrade because they weren't sure earlier of their own policy benefits. And interestingly, after a year of running this navigator, increasingly, the gap between what we predict and what is actual is significantly reducing. Now, how did we make this popular? We integrated this into the whole intimation process because the members have to intimate, right, upcoming hospitalizations. And this is what is helping customers make financially prudent choices. Now, that's about checking into a hospital. Now, how do you get out of a hospital? Today, we spoke about Raksha Prime. Now, the same capability to estimate, we share that estimate with the hospital and the members. And with the level of trust that we've been able to build because we underwrote that estimate. So far, over 400,000 members have been able to walk out of the hospitals before the bills got generated. And we continue to get a 4.7 consistent rating on 100% of these discharges that are facilitated through Raksha Prime. And it's been a very phenomenal journey in the last 1.5 years. Starting with less than 600, 700 discharges a month, we've actually grown. In fact, as the bar extends, we're currently at 35,000 discharges a month. And that's what Raksha Prime delivered. Now, what's next? In our belief, the next wave, because we're happy with the 15%, and of course, we're making 15% happy. How do you make the 15% or 50% or we have to really put the providers in the driver's seat. Remember, in the last 1 year, we never went back to a hospital and say, change your process. We've not gone back to an insurer and say, change your process and reimagine or adapt or do something. We actually just inserted a simple estimate into a regular process, got the patient out of the loop, and converted discharge into a simple B2B transaction between payer and the provider. And we told the patient, you can go home. You don't need to be sitting there and waiting for it to happen, right? You can actually go home. Now, how do we put providers in the driver's seat? Interestingly, while we always talk about cashless from a member perspective, cashless is delivered by the hospitals or the providers. Yet, by design, cashless today is a payer-led process because no hospital wants to take a decision without actually going back to the payer at every transaction level. So even today, in the Indian industry, when the moment of truth comes, takes all of this documentation, throws it to the wall, and then say, dear payer, tell me how much will you pay, so that I can actually collect the balance from the patient and then let them go. But the only way to eliminate that friction and eliminate the dependency is somehow magically move the process from a payer-led process to a provider-led process, right? So that they can actually make those decisions on their own. So we now, for the next wave, we are bringing our counseling, which is the estimation, our checkout, which is Raksha Prime, and the insights that are required to do this with confidence, all of this into a provider-led, provider-managed tech platform. That's what we're going to do. And to make this obviously to happen, you have to enable provider to sort of safely own cashless outcomes without ever going back to an insurer in real time. And the next wave, hopefully when we finish executing this, we will actually get 1 in 2 members walking out of the hospitals without actually waiting for a bill to be generated. Now, how are we going to do this? This is how we're going to empower the providers, right? Which is the AI platform that the providers will have access to, so that the providers are able to click a button, get a push notification, and then I'd say, okay, let this patient go. And everything else is sort of taken care of by the platform. need to solve. Okay, now this is a lot of text, so please don't read, right? So this is where we went back and reimagined how we look at technology in this business. Historically, like we are good corporate citizens of the Indian health insurance industry, in all our life we built tech for to be a payer-led process, as built into our claims platform. Into our matrix platform, we built, whether it is estimations, whether it is discharges, whether it is prime, everything was built into a payer-led process or a claims process. Now, this is where we're saying we need to reimagine this to be a provider-led process. So what we've done is to take all of these pieces that were historically on the payer-led process side, reimagine the stack, and then putting that back with the hospital so that they can actually do a self-serve. And in some ways, you're expecting the provider to take a leap of faith that the insurer will actually honor that estimate, right? And that leap of faith will happen when, one, you're not getting too many things wrong, and that you're able to say these rules and constraints are correctly applied, right? And of course, this is not enough just to give you an estimate, but you also need to make sure that there is no foul play at each transaction level, and that the contracts are being adhered, there is no fraud, waste, and abuse. And in our reimagined technology stack, okay, it's not my best work, but I will try and explain. In the past, we've had these distinct capabilities built on top of Matrix as a platform. We built Prime, we built Navigator, we built AI, because we fundamentally believed everything was about a claim. And we are moving that into what we believe, and this was the past. In the last few months, we've sort of changed our mindset a little bit, then went back and said, the provider pieces have to be surfaced independently on top of it. Now we are further reimagining that. We are saying that the payer and the provider-led pieces are two sides of the same coin, but they need to actually be built on the same stack, same AI capabilities, so that the entire contract enforcement is fully automated. And of course, at the core of it, the outcomes that our FWA engine has actually thrown out. And we used to run this like a batch process, we used to run like an insights, but today, Maven Guard, which is the new public avatar of the FWA stack, is able to look at every claim in real time and 100% of the claims as it processes through. In fact, it's not just when the claim is ready, when the paper comes in, when we scan, when we code, when we get more details, when we make the adjudication, when we get more insights. At every stage, Guard actually runs and sort of reassesses whether the fraud indicators are okay or not okay. And today we analyze hundreds of parameters across several categories of claims. We are able to uncover collusion, and we've got some very fascinating insights on like lookalike claims, including the values that are submitted in the bills and the labs. We're doing very interesting work on finding forged claims, the documents that are actually forged. We now know every entity in the country. It could be a mobile number, it could be an email ID, it could be a PAN number, it could be an agent, patient, hospital, the desk. Everything is an entity and every entity has a score. We actually know millions of these entities today in all of India on what is their fraud propensity and then what they actually contribute to fraud, right? And every claim that is submitted is actually going through this filter 4 to 5 times during the life cycle of a claim and allowing us to get sharper and sharper. Of course, we are still scratching the surface. We saved about 400 crores last year, potentially a 700 to 800 crores run rate in the current year, which is nearly double that number. And we're improving conversions, right? In the past, our sample conversion rates were so low that historically we went to a lot of genuine customers. Interestingly, the 2x to 3x more fraud, 4x to 7x hit rate increase came with us reducing the number of field investigations by 25 to 40%. We are actually doing far lesser work. We are going to lesser number of customers and asking them difficult questions. But yet, we are actually finding more because we are getting sharper and sharper by the day. And interestingly, you would know that MediAssist is a very dominant player in the group business, employer-employee business. So please see this in the context of what we are able to do in historically understood as a clean business, which is the employer-employee business. And our outcomes in retail are even far superior, right, from what you're actually seeing today. Okay, so we now know, for example, by industry, by location, by claim type, by policy type, by distribution, by ailment, we actually know what happens in the country today. It could be an unrelated data point, but this year, in the first half of this year, we processed an absolutely lower number of infectious diseases compared to last year. The incidence of the infectious disease claims in our portfolio has actually dropped in absolute number despite the growth in the underlying portfolio. Of course, it has moved to something else, right? But so we actually know some of these extremely well. We're using to go back to our insurer partners and saying, listen, in the past, you asked me to investigate, say, everything about 150,000 or everything about 200,000, right? But the fraud distribution is not even, right? The fraud distribution is very different based on the value, the claim type. And happy to report that some of our insurer partners are coming back and saying, let's revisit the sampling strategy so that we can actually improve the outcomes. And our ability to find fraud now cuts across all kinds of misrepresentation, and not just any one specific type. It's now time for us to open up this FWA capability that we've again, like good citizens, built inside Matrix, which is our claims platform. We've been able to actually extract this out as an independent capability. And Maven Guard is today available for any insurer with any claim system as an add-on. And we can actually put this on top of any legacy claim system in a 5 to 7 week time frame. And we've actually done this very interesting test on a non-matrix system, which of course we have access to. And in 60 days, we're able to get a 10 to 15x improvement in the hit rates from some of the legacy systems, right? So this is something that's available as of today. So we spoke about what we're going to do with the hospitals, how we're going to enable, and for the hospital to do that, we need to get them integrity, we need to make sure that the transactions are verified, the payers are comfortable. Of course, at the core of all of this, again, was something very embedded inside the Matrix platform in the past, in the claims platform. But we now realize that different insurers, different payers, different players are at different stages of evolution in the technologies thing. So we went back and looked at every single use case that occurs on the payer side or the provider side today. We said, we're not going to tell you how to run a claims process. However, I know that you need to scan documents. I know that you need to look for forgery. I know that your account managers need to generate a custom report, right? And we know that repricing, contract adherence, audits, and so on. So what we've done is to go inside Matrix, pull all of these capabilities out as single atomic capabilities, put them all into a stack, and we are now making that available to the whole industry. So you use whatever you feel like, whatever you think is useful for you as a payer, as a participant in the ecosystem, and it doesn't matter, right? So for example, we've got a standalone bot, which if you let us train on your policy, explain the claim level deductions and overlay that with your policy benefits, and actually explain that in English today, right? So that's what we are attempting to do. So this entire AI stack that has historically been buried deep under Matrix in our own claims platform, we are opening that up, and we are opening these capabilities to every single provider and payer that exists there. So that's the third thing that we're launching, right? From the provider, the fraud, waste, and abuse, and the AI capabilities. And of course, our platform continues to be available in all of these flavors today. Matrix is our platform. It's available to every insurer to process their claims. We don't need to touch it. We don't need to be the processing. We don't need to be the TPA for that business. We have a Maven Global, which is for the global IPMI business. We have Maven Guard, with all of our understanding and experience of FWA now available as a standalone AI capability that can sit on top of any claim system or any data source. The entire set of AI capabilities, we saw the whole laundry list as a stack on which you build your own applications. That's the Maven AI stack. And lastly, the hospital sort of becoming empowered to let patients walk without the fear of losing money and without actually having to wait until the payer actually gives you a confirmation. And that's Magnum. That's actually will be available as early as Jan 26, once we finish the beta with some of these providers and payers. So that's basically what we are bringing to you this year. So this is our next step towards instead of 1 in 6 patients walking out, how do we get 1 in 2 patients walking out of the hospitals? Instead of detecting 2.5–3% of the payouts as the fraud, what can we do to improve that number to a 4.5, like 5%? Because today it's our belief that there is at least an 8–10% leakage on account of fraud, waste, and abuse. So in a business, in a health insurance market, which is in the famous Indian numbering system, 1,20,000 crores, that still is a 10,000 crore number. And we are not saying everything is fraud. We are not saying everything is waste. We want all of us to be mindful that these are 3 different aspects. They are not one and the same. Historically, we looked at everything as fraud. So it's our absolute endeavor that we find every rupee of FWA that's sort of impacting the insurer portfolios and return that back to the insurer. And that's our commitment. That's our understanding of how we actually want to come back to our original theme of sustainable benefits and effortless experience, right? So this is what we are launching today. Sorry, there were too many of them, so we couldn't do an online demo, but happy to have conversations, understand what we can do. because it's our fundamental belief that at scale, if you want to cover all of India, and with transactions growing much faster than premiums, while premiums are going up, all of us are concerned. You ask us, transactions are growing even way faster. Okay, and some of you might find it surprising, especially as India moves away from plain vanilla inpatient-only catastrophic care cover, covering standalone outpatients, ambulatory care, primary care, and everything that all the friends said, in the previous time. Rates are going out of the whack. Okay. As MediAssist today, we process more outpatient claims. 55% of the claims that we processed last year were outpatient claims. It's only 45% covers in the country today. And we are not counting pre-post hospitalization covers. We are talking about pure play outpatient benefits, like pharmacy refills, 11 claims for 100 lives. I have corporates where the outpatient incidence is 150%. I'm actually getting 150 claims for every 100 lives, and that transition happened just last 2 years or 3 years. I mean, for me, as somebody who's tasked with processing transactions, it's a killer. So we have no choice. Tech-led solutions, if you really want to deal with this massive increase in incidents that is coming our way, because it's nice to say we'll expand benefits, but the benefits will translate to transactions. Your characteristics of fraud, waste, and abuse, characteristics of automation, characteristics of network, everything is undergoing a dramatic change. And with the regulatory push to improve experience, for example, cashless everywhere, today, 72 hours decide whether you will honor a cashless request from a hospital that you've never known. Because that's cashless everywhere. That's the intent. Because the idea was that everybody will walk in and get cashless on demand. But look at what it is doing to our processes. In the past, we took 6 months to empanel a hospital. We did verifications. We did field audits. We checked if they had an operation theater. Did they have consultants? Did they have a... Done that. We've negotiated rates. We then took a very careful consideration on whether that hospital should be on our network. It is no longer the case. We get 72 hours. And then suddenly your whole fraud, waste, abuse characteristics in cashless are undergoing a dramatic change because it's not network, but behavior. Build everything that we're building to manage our scale, which by the way is about 25% by premiums and nearly 50% by claims volume of the industry today. Because our platform is used by insurers who also do in-house processing. So here is our commitment as we sign off today, that we will bring everything we know into a set of core capabilities that the entire industry can actually use. Of course, please pay us for the cost, but use the entire industry, and hopefully we will make benefits sustainable and the experiences effortless. Before we sign off, I would like to take a minute and get my entire team that sort of worked on this stack a moment just to show their faces. Right? Thank you so much for patiently listening to this story. Thank you. Okay. the customary things, right? Thank you so much for giving us an opportunity to do something like this, right? And this is the core team that's behind a lot of these features. Just keep going. Yeah, that's as far as we'll go. Thank you, and have a wonderful day. Thanks.
Thank you, Satish, for detailed walkthrough on the launch of new products of MediAssist. As we draw our formal proceedings to a close, it's time to reflect on the powerful insights and the connections we built together this morning. Again, I would like to invite Mr. Nikhil Chopra for closing address. Nikhil, may I have you on the stage, please?
Thank you, Gigi. Thank you, everybody, for patiently listening. And I hope and believe that you all found all of the sessions insightful and something that you all can take away. As we come to the close of today's session, I want to reflect on the shared purpose that has brought all of us together. We started the morning talking about borderless health, a system built on access, affordability, and trust. And through the day, every conversation, every perspective, and every insight has reinforced one fundamental truth. Meaningful change in healthcare happens only when the ecosystem moves together. Today, we saw how sustainable benefits and effortless experiences are not just ideas for the future, but realities we are collectively building. Through smarter design, deeper collaboration, and a relentless focus on the member. On behalf of MediAssist, I want to extend my sincere gratitude to all our panelists, partners, and leaders in this room who are shaping the future with us. I want to especially thank Simon for the fantastic keynote address. We learned a lot from everything that you stated. Extremely insightful. Thank you once again. Very special thank you to our sponsors whose support has made today possible. Your commitment to advancing healthcare what enables platforms like this to exist and grow. Thank you all for your engagement, your questions, and your time. We look forward to continuing these conversations and partnering with each one of you as we move towards a world where every claim is predictable, every experience is effortless, and every member feels truly cared for. Thank you, and have a wonderful rest of the day.
That concludes the formal agenda for this morning. We invite you to join us for lunch to continue the conversation and connections you have sparked today. Thank you.
Healthcare shouldn't be this hard. Fragmented, complicated, unpredictable. This is how health benefits feel like. At MediAssist, we believe benefits should feel effortless, not painful. We are India's most trusted health benefits administrator, connecting insurers, hospitals, and millions of members into one seamless, technology-led ecosystem. A network of more than 200,000 providers, reaching across 185 cashless, reducing financial stress when members need care the most. 85% of cashless claims submitted digitally, removing friction across the entire chain. Over 400,000 members walking out of hospitals before the bill is even generated, powered by Raksha Prime. Delivered across more than 4,000 hospitals through predictable, transparent, effortless journeys. And the system stays sustainable. Less than 5% medical inflation, versus 12 to 14% across the industry. 400 crore rupees saved through intelligent, precision-led fraud detection. This is how we reimagined cashless and proved it works at scale across India. Now, we're ready for the leap. Our ambition is clear: to deliver health insurance for that are effortless. A future built on trust, on intelligence, on connected systems, and on collective governance. This is the ecosystem we are building for India, for the